Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about provider types and specialties. I had a viewer ask me to do this video, and I'm very happy to do it. I think that it's a fun topic, to be honest with you. And although I know all of the specialties and subspecialties out there, I thought it was really fun for me to kind of do a little bit of research on the American Board of Medical Specialty to find out exactly the number of specialties and subspecialties that are offered out there. So, I mean, I learned something new as well, and I always love learning new things. So I appreciate to that viewer for asking me to do this and to spread the knowledge out there. So we're going to go ahead and jump on in. It probably won't be a super long video, but I think it will be informative. Even if you are a provider, you might learn something new. So I would love to hear from you after this in the comments if I said anything that you weren't aware of. I have my little trusty notes here that I took. But basically what happens is when a medical provider is in the medical field, they are choosing what realm they want to work in healthcare, right? So you have physical therapists, you have occupational therapists, you have speech therapists who kind of work in that physical therapy kind of world, okay? And they kind of work together. Usually there are, together in the same clinics or related practices where they can refer patients internally if they need speech versus physical therapy versus occupational therapy. And then you have, of course, the behavioral health side of stuff. So you have psychiatrists, psychologists, social workers, counselors. I mean, there's a big realm in behavioral health all on its own. But what I'm going to focus on today, instead of going into all of the other kind of ancillary healthcare professionals that are out there, I'm just going to talk about doctors, so MDs and DOs. MDs are medical doctors. They go to medical schools, and the initials MD is just indicating the type of medical school that they went to. So they went to an allopathic medical school. DOs are medical doctors as well. They're doctors of osteopath, and the DOs, after their name, specify they went to an osteopathic medical school. They learn the same stuff. They are capable. They're all capable. They all have the same knowledge base. The osteopathic path, if you will, has a philosophy different than the allopathic. And I could go on with this for a very long time because I've worked for osteopaths for a very long time. But they definitely have an approach where they treat patients as a whole. They learn hands-on manipulation, and you're thinking chiropractor, which it is similar, but it is different as well. And they learn how to do a lot of musculoskeletal realignments and stuff like that. But basically, MDs, DOs both get chosen for the same residencies, same programs. It all feeds into the same medical world, okay? It's just whatever preference the student has when they choose their medical school and which philosophy they want to follow. You can look this up on your own. Neither one is bad, neither one is better. It's just they're different. Then a medical student after 4 years has to pick a residency program. And this is going to be where they want to focus their careers, where they want to specialize, if you will. And because in medical school, medical students, their last 2 years, they do rotations through all different specialties, it's supposed to help them get an idea of where maybe their calling is, what they're more comfortable with, if what they think they want to practice in that type of medicine is true and it's what they thought, so they can pursue it for residency. It's really to work out and figure out what they want to do for applying for the residency programs. So then they do a residency. Depending on the specialty, it could be a 4-year, 3-year residency. It could be a 7-year residency. It just depends on the type of medicine they want to practice. And every specialty, every residency has its own board that certifies in that specialty. So when a medical student gets chosen for a certain residency, which is in a specialty, family medicine, internal medicine, that kind of thing, which there are 40 different kinds, by the way. I looked on the American Board of Medical Specialties, 40 different specialty certifications out there to take boards for. They choose their residency, they choose and apply for which residency program across the nation they want to be chosen for. And it's a very competitive world out there for it. So they have to have like a backup plan if they don't get into their first residency choice. And then once they get to their last year of their residency program for whatever specialty it is, they can sit for the boards and they can become board certified. Board certification is required now. Before it wasn't, and you had doctors who kind of got grandfathered in and they did their residencies, it fulfilled the needs, and they did not have to take the boards in whatever family medicine, I think was one of them. There were a few that were exempt. Not all of them were exempt, but a few were. But now everybody has to take their boards. There is a certain time frame from when the person finishes their education and their residency program to when they have to take their boards by. So there's kind of like this time frame that if you go too long, then you won't qualify for the boards anymore. So it's really important they take their residency board certification at the last year of their residency, and then they have to recertify every so many years depending on that specific board's requirements. So you'll have the family medicine board, you'll have the internal medicine board, you'll have dermatology board, you have 40 different boards that manage the certifications for those specialists. Then you have subspecialties in each specialty. So out of those 40 specialties, there's a total of about 90 subspecialties. Now, every specialty might have multiple difference that they can sub-board certify, or they might just have one. But there are up to 90 subspecialties that different boards could govern. And so if a doctor decided, like let's say they're pediatrics board certified after their residency, and something triggered them while they were doing their residency or while they're practicing as a board certified pediatrician, that they want to do neuropediatrics or cardio pediatrics. There's a bunch of different sub pediatric specialties. They would need to do a fellowship, which is like a residency, but specializing in just that subspecialty. And there's different requirements for that, like how long they would need to do the fellowship, if it's a fellowship and maybe practicing for a certain amount of time, or they have to provide certain written information from somebody who oversees the program. There's a bunch of criteria for different subspecialties. And then they would sit for the boards for the subspecialty to become certified and boarded in the subspecialty. So they could be a board certified pediatrician with a sub board certification in cardio pediatrics. And there's different requirements for keeping that sub board certification active. So these people doctors who go in, and they can be MDs or DOs in all specialties, by the way, and subspecialties, they go in and they're like, okay, well, I'm being really pulled to this and I really want to focus and be like my niche. This is what I want to do. And then they go to school even longer and they focus even longer. I think it's amazing that there's so many opportunities out there, and there are some that are very obscure that a lot of people don't know about, they don't go into. And that's why sometimes when people get sick and they need a certain subspecialist, it might not be offered in their area and they have to fly somewhere else in the country to find somebody who has specialized in what they need. I am going to put the link to the American Board of Medical Specialties in the video description. It's very interesting to look at. They have a very cool table set out of all of the specialties of the 40 and what's required and who governs it. And then they have another table that looks just like it for subspecialties, and it tells you the subspecialty, which boards could govern it, and oversee it, and then their criteria to meet in order, like fellowships and stuff like that that I talked about. But there is so much out there, and that's why when you're credentialing a specialist, contracting for groups, that you understand this and that you can communicate and ask the right questions with the providers that you will be working with. Because if they have multiple board certifications, they have multiple niches, that subspecialties in which they work, you want to make sure, if you're the credentialing specialist, their manager, that your contracts accurately reflect the reimbursement, the taxonomy codes, all of that, because it's all tied together. And I could do a whole nother video about that. Maybe I will, but the taxonomy codes, reflect the specialties and the subspecialties, and that's how billing gets created, and that's how billing reimbursement gets established. I mean, it goes on to this whole other realm, but to keep it very simple, you have the medical doctors that go into a residency for their specialty, and then from their residency, they can decide if they want to do a subspecialty. They don't have to do a subspecialty. They can stay just internal med, or they can stay just emergency med or family medicine. It's not a bad thing by any means, but there are opportunities to do subspecialties for those doctors who wish to do that. And it doesn't need to be done right away either. I mean, it could be something that after they've worked as an internal med doctor for so long, they decide to get their subspecialty. I mean, that's something that can also be pursued at a later date. If you have any questions or comments about that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this knowledge with anybody whom you feel would be interested. I appreciate the support. We'll see you next time. Bye-bye.